86.8% of patients use their inhaler wrong. Nearly half make a mistake so serious that almost none of the medication reaches their lungs. That means right now, 9 out of 10 people breathing in their medicine are wasting it. And they have no idea. I am Dr. Suman Paul, respiratory consultant in the NHS and private practice here in the UK. In 15 years of treating COPD and asthma patients, this is the single most common and most fixable gap I see. Let me tell you about a patient I will call David, 64 years old, 2 years on his inhaler, still breathless, convinced his medication had stopped working. I asked him to show me how he used it. Within 5 seconds, I had my answer. The drug was never the problem. The delivery was. Today, I am demonstrating the correct technique for most common types of inhaler available in the UK. Stay with me because the technique that's right for one device is completely wrong for another. Here is what David was actually doing. He wasn't shaking his inhaler. He was pressing the canister and breathing in at completely different moments. He never held his breath afterwards. So the medicine fired straight to the back of his throat and got swallowed. Barely any reached his lungs. 2 years of taking it religiously, 2 years of it never working properly, and nobody had ever once watched him use it. That single 5-second check changed everything for him. And it's the same check I want to give you today. But before any technique makes sense, you need to understand something almost no one explains. There are completely different families of inhaler and they don't work the same way at all. There are broadly 3 families. The first is pMDI or pressurized metered dose inhaler. The classic press and breath puffer like Trimbow or Trimbow. A pressurized canister fires the dose out fast. So if your breath doesn't match that timing, it hits your throat instead of your lungs. That's the coordination trap, and it's where most people fail. The second is the DPI, the dry powder inhaler like Ellipta, Symbicort Turbohaler or Fobumix Easyhaler. No propellant at all. The power comes entirely from your own breath. The third is the breath-actuated inhaler, the hybrid like the Fostair NEXThaler. You don't press anything. The device senses your breath and fires for you. In the UK, you will also see breath-actuated puffers under names like Easy Breath, Autohaler and Khaler. So, which one is right for you? Most people assume it's just whatever they happened to be handed. It isn't. The right device comes down to 3 things you have probably never been asked about. Your inspiratory flow, which means how hard you can actually breathe in, your hand to breath coordination, and your age. An 80-year-old with arthritis and a younger person mid-flare need completely different devices. There is a detail most people miss. Trimbow comes as both a puffer and a breath-actuated NEXThaler. The same triple therapy medicine shown in studies to have comparable efficacy when used correctly, just 2 completely different devices. The medicine isn't the decision. The technique is. If you are already thinking, nobody has ever actually watched me use my inhaler, drop a comment below because that's the exact gap I want to close today. Now let me demonstrate, starting with the puffer. For my puffer demonstration, I am using Trimbow, a triple therapy pMDI, and there is one accessory that can significantly increase how much medicine reaches your lungs. Yet, most people have never even been offered it. A spacer. If you use a press and breath inhaler like Trimbow or Trimbow, you should be using one. Here is why. With a pMDI, only a fraction of the dose actually reaches your lungs. A lot of it ends up coating your mouth and throat. A spacer holds the medicine in a chamber so you breathe it in at your own pace, which can significantly increase the amount reaching your lungs and reduce what's left in your throat. So, the steps with Trimbow. Check your dose counter. Shake it for 5 seconds because the drug separates from the propellant and your first puff could be mostly gas. Insert it into a spacer. Breathe out fully away from the device. Seal your lips around the mouthpiece. Press once and then breathe in slowly, like sipping through a straw. But there is one step people skip constantly, and it quietly cancels out everything they just did right. Hold your breath. Aim for around 10 seconds or as long as you comfortably can. Perhaps 5 seconds if you have COPD. If you exhale straight away, the medicine comes right back out before it can settle on your airways. So hold it as long as it feels comfortable, ideally up to 10 seconds every dose. And one more thing, Trimbow contains a steroid, beclomethasone. So rinse your mouth and spit afterwards. Steroids left sitting in your throat causes oral thrush. I have seen patients investigated for throat cancer when the real cause was inhaler residue from skipping that one rinse. One genuine advantage of Trimbow is that it is extra fine particle formulation designed to reach the smaller airways dipping the lung, but only if your technique gets them there. Now here is where it gets dangerous because the dry powder inhaler needs the exact opposite technique. And most people carry their puffer habit straight over to it. With a dry powder inhaler, your breath is the propellant. So that slow, gentle sip you just learned, wrong. Here you need a fast, hard, deep breath. Let me demonstrate with the Ellipta, one of the simplest devices there is. Open the cover until it clicks, which loads the dose. Breathe out fully away from the device because moisture ruins dry powder. Seal your lips, don't block the air vent, then breathe in hard and fast. Hold for around 10 seconds or as long as you comfortably can. Close the cover. The Symbicort Turbohaler and Phobomix EasyHaler work on the same principle. Load, forceful breath in, hold, just with a different loading action. Between 32 and 38% of dry powder users don't breathe in hard enough and the powder never leaves the device. So remember this one line and you are ahead of nearly everyone. Puffer, slow and steady. Dry powder, fast and forceful. Get them the wrong way around and your medicine goes nowhere. Now there is a third type that sits between the two, and for a lot of my patients, it's the one that finally solves the problem. The breath-actuated inhaler. This is the Fostair NEXThaler. The technique is beautifully simple. Open the cover, breathe out away from it, seal your lips around the mouthpiece without covering the side air vent, and breathe in hard and deep. The device senses your breath and fires the dose automatically. You will hear a click that confirms it's released, and there is a dose counter so you always know where you stand. Like Trimbow, it's an extra fine formulation built to reach the small airways. No pressing, no timing, no coordination to get wrong. So why does a device like this matter so much? Because of a patient who could do everything Defit could except one thing. Margaret, 72, severe arthritis in her hand. She physically could not press a canister and breathe in at the same moment. Every single puff was mistimed. For her, better technique was never going to be the answer. Her hands simply wouldn't allow it. She needed a device that did the timing for her, a breath-actuated inhaler like the NEXThaler or EasyHaler. Same condition as plenty of my puffer patients, completely different solution. And remember, even the puffers can come breath actuated like Easy Breath, AutoHaler, KHaler. So there is almost always a device that fits the patient. The inhaler was never the problem. The match between the person and the device was. So before you go, let me run through the mistakes I see every single week. Because 76% of patients make more than one. Not shaking the puffer, you breathe gas, not medicine. Breathing out into the device, moisture clumps the powder. Skipping the breath hold, try to hold for as long as you comfortably can. Mixing up techniques, slow for puffers, forceful for dry powder. Forgetting to rinse after a steroid. That's how thrush starts. Covering the air vent on a NEXThaler, it can impair drug dose delivery. And using a dry powder inhaler during an acute attack. You can't breathe in hard enough mid-flare, which is exactly when you reach out for your blue rescue puffer or a salbutamol nebulizer instead. Studies show patients today are no better at using their inhalers than they were 18 years ago. Nothing has improved, and that's not your fault. It's a gap in the system because a rushed appointment never has time to actually watch you breathe. If you are in Liverpool or Manchester area and you have never had someone properly check your technique, that's exactly what I do in my clinic. Your device, your breath, your treatment plan together. The booking link is in the description. Now your technique is right and your medicine is actually reaching your lungs. But for some of my patients, even perfect technique and the right inhaler isn't enough. And in March 2026, something changed for those patients that most GPs still haven't told them about. Check out this video where I explain the new NHS COPD injection, whether you qualify, and the one number in your blood results that decides everything. I am Dr. Suman Paul. Thank you for watching. See you on the other side.